welcome back. I'm your host, Michael Stamatinos, with the Advancing Healthcare Innovation Show. And if you're new to us, we're very passionate about healthcare innovation and adoption. Our aim is to bring real stories from real people that are on the front lines that are innovating within healthcare. And we've got an action-packed year with a ton of incredible content that's been planned. And if you haven't checked out any historical interviews, go ahead, hit the subscribe button, hit the like button. You can check out all the interviews on our YouTube page. So without further ado, delighted today to be bringing to you Victor Chapela, who is the CEO of Suggestic. Victor, welcome to the show.
Thank you so much, Michael. Thanks for the invite and a pleasure to be here.
Well, Victor, I think that your background is pretty incredible. And if you wouldn't mind, for those that are not familiar with the story of Suggestic, it's sort of an amalgamation and an evolution of a lot of different things that you've done historically into what you're doing today. So would you mind maybe just kind of giving the audience a little backdrop into who you are and what we're focused on within Suggestic, and go from there?
Sure. So for me, there's so many aspects that you can talk, because it's a life story that, as you say, is like the culmination of a life story. So I think that the relevant things for Suggestic that are, and why I'm doing what I'm doing, is when I was a kid, I was diagnosed with in the spectrum, with Asperger's and dyslexia, and that was, I think that's highly correlated with the fact that I started programming when I was 9 years old. The computers were my safe haven. I was working in that, like when I was 12, 13. I had my first company, software development company, by 15, and then I became an entrepreneur as a consequence. It's and you know how that goes. It went very well. I sold my first company, like I had 300 employees by 23, sold that company. And then by year 1999, in year 2000, I was like raising dozens of millions of dollars and shopping for a helicopter. And then all hell broke loose, and I lost everything. And little time later, I didn't have money at all. I owed a lot, and I didn't even have money to pay the cab to get to hospital so that my baby daughter could be born. So things get tough. And in that process, like one of the things that happens when you face like this rise and fall is that you question what you're doing everything for, and what's the meaning of life, and why you're working so hard, and what it is that you really want to do. It brings afloat your fears, and it allows you to see like an X-ray of everything that motivated you so far, which was this kind of like bizarre notion of being successful. And then you realize, like, is that really success? Is that like, and so I in the process, I started hacking, and I did an information security company next, and that went very well. Also got acquired alongside a spin-off we had done, and our artificial intelligence for fraud prevention. But once that happened, like one thing that had been a common denominator through all my life was that since very early childhood, I was continuously sick, like digestion. And it took me, after I realized it was not normal to be sick all the time, it took me like 10 years of going to all types of doctors until I finally figured out I couldn't eat gluten and dairy, or they figured out. And once I took those off, my health improved significantly. And then it became like this voyage of searching how to optimize my health through what I ate, through what I did. And fast forward 15 years, or which is now, and I had realized that I could optimize, but I also knew how hard it was. And figuring out what it is that I needed to optimize on, what should I stop eating, what exercise should I do, but especially food was extremely complex. And so Suggestic really started from that understanding that we needed a way to capture the complexity, reduce the complexity for the end consumer and the individual, and allow this to be delivered in a way that we could actually improve our lives and live longer, healthier, and happier lives. And that's how, that was the origin of Suggestic, was really bringing everything I had done in technology and my ability to build companies and grow them. And finally, this mission of how could I make it easier, not only for myself, but for everyone in the world that needed a different way of interacting with food and lifestyle.
Pretty spectacular. So you've done a lot of these tours of duty in terms of going from the highest of the highs to the lowest of the lows. Would you say now, are you more able to sort of appreciate the little wins and also have a perspective when things aren't going as well as you would have sort of expected or imagined in certain situations?
No. So there's one thing that changes though, which is, I think that for me, for most of my life growing up, I was never satisfied with what I did. I was always feeling that I was not good enough, that I was kind of like, because when you have a lot of early success, you end up feeling that it's kind of like that you're an imposter. That is not that it's, you know, that a lot of that didn't really depend on you, and you know that a lot of that was based on just being in the right place at the right time. Whereas after you lose everything and start all over again, there was a newfound admiration or for not only myself but for others, and these little things that, and I think that the main difference is, before losing everything, and I fundamentally didn't appreciate anything I did, and I didn't appreciate anything anybody else did, because it was like, if you have to start with your own appreciation, and that makes it a very sad place to be in, because you're always feeling it's not good enough. Whereas once, after I realized this for the first time, because I had never told anybody I admired them, and after losing everything and starting all over again, I started admiring people, and it came with, and then I realized that I actually was admiring and being grateful and for my own little successes, as you're saying. So it's in a way, the main change I found in myself was that I could uh, uh, I could stop trying to be more than what I was, and started valuing what my efforts and what I had done and what I had achieved. And I think that there is a change there, and it does come through the I do believe that the best thing that has happened to me was having to start over again in a profound way.
That is pretty profound. So thinking about fast forwarding to what's happening now with Suggestic, when we think about food, it's something that we can't live without it. And yet the system of which we operate in today, from a incentivized place, we care for sick people. Physicians are able to um, incentivize to care for people that are sick. When you fundamentally change the game and try to help people kind of stay out of those situations, can you maybe talk a little bit about some of the tension, some of the roadblocks that came up, from a business model perspective as you guys were evolving into what it is that you're doing today?
Yeah, that's fascinating, because when we started Suggestic, we knew there's a big problem, and the problem being, health is mostly determined by our lifestyles. So every single chronic disease stems from this, from the way we eat, we like how we sleep, our stress, etc. However, changing that is very complex because each of us has different parameters for what we want to eat, what we like to eat, what our body needs, what is available around us. So really, that's a data discovery problem that we thought we could solve. So we knew there was a solution. The solution being we can find what it is that you should eat, that you would like to eat, that is nearby, that is within your budget, and that is the data discovery problem. We can match that with you, and therefore create a kind of like a low friction, easy, convenient way for you to change your lifestyle. However, we knew the solution, we knew the problem, but we didn't know how to monetize that solution and problem. And so we first started with healthcare. We tried to go direct to payers and providers and pharma, and we met with most of the largest insurance companies and hospital systems, and some would call us and we would call them, and we were focused on diabetes at first because we realized that that was, at least out of all the chronic diseases, the one that was most obviously linked with food, although all of them are, but that was the most obvious one. And then my father was diabetic, my co-founder's father was diabetic, so we knew that we had a situation where we knew that we could help other people, and it could even reverse diabetes in many cases. However, as we started to do that, we realized that the business model didn't match the business model of the healthcare system. And the healthcare system as a whole really makes money out of surgery, out of medicines, out of hospital beds. That's where most of the money is made. So if you want to really put anything that is lifestyle based into that system, there's no way for them to monetize or make a profit out of that. So after several evolutions and trying to figure out, like, we would go to large companies and they would say, oh, I love what you're doing. Let me put you in touch with our marketing department. And I go, we are talking about health, just it's a different way of delivering health. And the only place where we could fit was in the marketing department, because nobody else had budget for lifestyle health, because there was no money to be, like, you can't charge people for getting better at home eating vegetables. So eventually we realized that the business model didn't match the healthcare system, and we went direct to consumer. We said, well, end users want to be healthier, and we're willing to pay to be healthier. That was certainly my experience, and we're willing to do this and do the hard work to get better. And that, although that's true, the number one problem we found by going direct to consumer was that customer acquisition becomes prohibitively expensive, because you don't know who wants to use it, because of this highly personalized need in lifestyle. Some people in the same household can have slightly different diets or completely different diets based on their own belief system, their own goals. Like, somebody can be training for a triathlon and somebody else wants to lose weight and somebody else wants to just sleep better. And then they can also have different things they like or dislike. Then on top of that, like, it makes it so that every individual dietary pattern, every individual lifestyle is different to each other. So finding those people who actually match your offering is very difficult and sometimes prohibitively expensive in terms of a customer acquisition to lifetime value. And these niches, these very narrow niches, makes it a highly, highly fragmented industry where people are searching for the solution as opposed to you being able to target them in any way. So we moved into so that's when, a couple of years ago, we already had all the infrastructure. We had the app that could actually play any type of lifestyle program with generating dynamic meal plans, generating having all the behavioral science to keep you on track. We had everything there. But what we didn't have was access to those audiences and the domain expertise that would go deep enough in each and to actually make them profitable. And even if we found a niche, it would be a niche. And the largest companies are in the millions of dollars or tens of millions of dollars, but they're not in the billions of dollars, except for one and only one exception, which is weight loss. Weight loss is broad enough to have large companies. But even then, I would argue that most weight loss, and you can see it even at the largest levels, goes through a process in which people are always searching for the new thing, and it ends up being that you will gain that weight back, and then you will search for a different solution. And that could be an app, or that could be a program, or that could be a pill, whatever it is. You end up searching for new things. So it's not a long-lived company ever. Anyway, so what we did is we moved to more being the provider with our solution to all these different companies, each of them domain experts in what they knew, each of them with a target audience that was different channels to get there. Some are going through the healthcare system, some of them are going direct to consumer, yet others are going through doctors, nutritionists, coaches or trainers, and every one of those has their distribution model, and their distribution model matches their product, their audience, and their content. And what we provide is the technology for each of them to deliver. That was the final fit that actually made the company take off. And it took off because we could now enable people with the technology to deliver these solutions to their audiences. And we could do it at a fraction of the cost, at a fraction of the time. And what we realized now is that we were a solution to a problem in search for a business model. And I had never seen that stated that way. And once you find that you are a solution to a problem in search for a business model, we probably would have iterated the business model faster, but we never really framed it that way. We framed it as, how do we make money, and how do we find the right fit? How do we make it scale? And today we're helping other people scale.
So in essence, it sounds like what's really happened is throughout this whole entire course of time, you guys have really built out an infrastructure. So I think about like a railroad. You guys lay down railroad tracks all across the country, and essentially people can say, hey, we've got these carts and we want to push certain things to certain areas. And you've just enabled that so that people don't necessarily have to go out and build their own railroad. You've been able to do it in a fraction of the time for people, where they can just literally sit on top of what you've already built and be able to move things at speed. So, I mean, you think about the types of people that you serve, and the types of people that your customers want. And it really boils down to one thing. They want speed, and they want results. And sounds like you're offering that. Well, you obviously didn't design it for it to happen in that way, but are you pleasantly surprised with what's happened as you've shifted and found a business model that is working, is taking off? And
Totally. And I think that what has been surprising for us is the amount of different ways in which companies and individuals and domain experts have found they can help people. And so we have everything from customers that are doing pregnancy to weight loss to things such as diabetes or autism, like really like a whole series of delivering nutritional and lifestyle recommendations to individuals, to caregivers, to health coaches that then can scale through this tele-wellness. And also the other thing that happened at the same time is, as we were transitioning into software as a service, COVID hit. So all of a sudden, telehealth became a big thing. And a lot of the barriers for telehealth to actually happen were brought down, which also helped tele-wellness, which is where we see ourselves fitting in. So I think that we were surprised. We knew that this was something people wanted, because we wanted it. We wanted this. But now what really, you gave the analogy of a railroad. I think that I'm a bit nerdier, so my analogy would be an operating system. So I think that what really operating systems allow you to do is connect all the pieces together and give users a common interface that they can interact with, that is proven, that people use. And I think if you think of any operating system like Android, Android basically matches any phone you want with the user experience and then has a layer of apps on top of it. So from Suggestic's perspective, we connect with labs and wearables. We have a interface for telehealth, which allows coaches to interact through chat and video and upload their own, the companies upload their own content in the form of articles or pre-recorded videos. And then finally, they can connect also to food delivery and grocery delivery, and even we're implementing restaurant delivery. So all those things together, what it does is now you can lower the barrier for adoption and the end user. Why? Because you can personalize it to them, you can guide them through the process, and you can make it more convenient. And people are buying health and nutrition because it's convenient, easy, personalized, and guided. And I think that combination of things, if you were to connect all the different devices and labs and things that you need to actually empower your, let's say, menopause weight loss app, you would need to connect all those things, then create your own tele-wellness or use different pieces. And then you would have to include more and more pieces. And then if you wanted to deliver food, you would have to also connect that. So all of a sudden, by having all that in the operating system, you can build on top of it. So we abstract all the complexity of connecting to all these pieces. And now we can deliver an app within weeks for any condition or problem. And that allows, like, we've had customers that go from launching in January and making and grow into $500,000 in sales per month by 3 months later, by April. So that gives them the ability to actually launch and test and refine and find those niches they want to do very quickly and scale at a different speed.
That's a great testimonial, by the way. Starting something from nothing, deciding that you want to build a solution, and instead of spending sometimes years, you're saying they can put something out there, test it, validate it in a short period of time. Are you talking months or weeks, days, hours? What's the span in which someone can get up and going here?
Reverse Health, which is one of our customers, they're basically doing this weight loss for women during menopause. Basically, that's our niche. It was 3 co-founders, one formerly from Google, the other 2 were marketers. They had been working on a different app, which was more on the keto side. So they knew how to build things and bring things together. And then all of a sudden they decided to put together their own offering. It took them 2 months to build the content and create all the technology. It took us a couple of weeks to deliver the app with their content. They launched in January, and by February they were doing $80,000. By March they were doing $250,000. By April they were doing $500,000. And that was, now keep in mind, they had both sides completely covered, which was access to their audience. They knew how to target that audience. They were good at marketing. So that is a key component of being successful, is finding inexpensively connecting with that audience. And then second, they had the content that actually appealed to that audience, to that. So it's more of a, we also noticed when we had the direct-to-consumer app, we had all these different programs, a lot of them from New York Times bestselling authors, and some generic ones. The difference between a generic, let's say, balanced diet to a specific program by, like, say, William Davis, who did the Wheat Belly 10-day grain detox in our app, it was like 20-1 better in terms of customer conversion. And they had 9 months of retention versus 2 days in the balanced diet. So the more specific you get, the more people are engaged. This audience this audience product fit, or this audience program fit, if you want to think of it that way, is fundamental. And it was the exact same set of features. It was the exact same app. The difference was not in the features. It was not in the technology. That's a commodity to nowadays. What is unique and what really adds value to individuals is, can you guide them through from where they are to where they want to be in the most convenient, easy way possible.
So talking about this journey, let's kind of, as we're wrapping towards the close of this conversation, which I'm thoroughly enjoying, by the way, is this notion, and we've had this conversation sort of off camera here, but this notion that wellness and healthcare, can you share your vision of the interplay between the relationship between both of those, and where they fit in your mind? And if you can kind of crystallize that, that would be very helpful.
I think that for me, there is one fundamental. If you think of healthcare as an industry, not as a concept around helping people be healthier, healthcare as an industry is not about. It's about really helping people who are sick, either revert that sickness. Especially, it's very good at reversing bacterial infections. So antibiotics is the biggest win in the history of healthcare, and it's still the biggest win. Everything else is not as good as antibiotics. Is a very simple causality. You have a specific molecule that kills a specific bacteria that gets which is causing this problem. But when you get into complex interactions between different systems in your body, those complex interactions are not normally easy to solve with one single molecule. So the whole healthcare industry is really built around single molecule, pharmacological, patentable things. And the money is made by patenting that, having this monopoly on that molecule for 20 years or whatever it is, and extracting as much value so that you can invest in finding other molecules to cure other things. But then the thing is, there are a bunch of diseases, which are not even diseases, they're imbalances in the body that arise from the food we eat, that arise from toxins that we are exposed to every day through food and through pollution and through everything, where the interaction we have with the modern world, and it's based on our stress levels, lack of sleep, lack of exercise, etc. So all those things are changing the fabric of our balance in our systems, and that is not solvable with a single molecule. So once you think of healthcare as an industry, and you think of wellness, to give it a name, as an industry as well, the main difference between the two is, I believe, is that healthcare is based on the single molecule or single surgery kind of like remove things or fix things, which is very good at. But then when you want to rebalance or optimize health, it's actually very bad at it. Why? Because it's not a single molecule problem. It's not, you don't have to kill something. You have to actually rebalance a very complex set of parameters that is best balanced through lifestyle. So you can much easier get better at any of the chronic diseases by changing your lifestyle than by having a pill. And so once you see that, like, one is short term, it's like curing something that will kill you very quickly, and that is healthcare's domain, is like the acute problems healthcare is very good at. But once that thing is taken a lifetime, and you have to rebalance something that you will have for the rest of your life, or you have, then lifestyle interventions tend to be much more powerful. Now, the business model problem here is that when you think of wellness as an industry, it is not distributed through healthcare. Healthcare doesn't have a business model, as I stated earlier, to actually profit from wellness. because it's long term, because it's not patentable, so there's no way to do the research, do the clinical trials that cost hundreds of millions of dollars to prove that an avocado is better for you than a pill. And even if they prove it, because of the FDA regulations, you cannot claim that avocado works as good as a pill, because they just assume it's too complex. There's too many things in that avocado to even have a causal relationship between the avocado and your health. So basically, the exact same clinical trial would render a very different claim if you're talking about food or even supplements, or if you're talking about single molecules. So that ends up having like two different industries, one which thrives in direct to consumer, which is the wellness industry, and one that thrives in this B2B model where insurance companies are paying healthcare providers and you're paying your money into insurance. So you're not really part of the solution. You're not even driving it. They're telling you what they'll give you for your money once you are sick. Whereas in the wellness industry, it's completely the opposite. You are driving the solution with your money. You're deciding what you want to do. It's just a different business model. And within that business model, I think it's a lot of the health and wellness, the wellness preventative lifestyle interventions are not only as good, but even better than a lot of the medical ones. Now, the difference is how you come about it. And there's all these. So when you see it in this discussion, when you and I had it, was like, you saw wellness as a subset of healthcare. I think that wellness and health and wellness are the encompassing, like that's what we want. We want better health, better wellness, optimize our health, live longer, live better. And that includes both, but they don't mix. There's very little overlap between wellness and healthcare, mainly. And I think that we're moving nowadays into scientific wellness, because now we have more devices, more at-home labs than ever before. And that allows us to actually track the progression and track the improvements that we have in our lives by changing the way we eat, the way we sleep, the way we exercise, and the way we reduce stress. And by having those, we have a new set of parameters which range from heart rate variability to ketones to measure all these different interactions in our body that are improving our health and optimizing over time. So what I see and foresee is that right now, only 3% of the healthcare industry is preventative. And most of the prevention is really coming from a different industry, which is called nutrition or food and supplements. And that prevention is not even labeled as healthcare right now. But it's already growing. Most people are buying functional foods. Most people are buying trainers, coaches, nutrition advice, apps. There's 200,000 app publishers around health and wellness and nutrition. So we are buying that. We're just buying it in a completely different way. There's no prescriptions. There's no disease naming, because you can't. And it's really about how to optimize health in different ways. And I think that that industry is growing at a much faster pace than healthcare. It will take over more and more. And I think that as it becomes more scientifically proven, probably in different places in the world, it will start first, because the US has completely privatized the healthcare industry. So there's no incentives for long-term health when you are reporting quarterly earnings in your to the stock exchange. But when you are in other countries where a lot of the healthcare is actually paid for by the government, they do have incentives for longer term health. So I think that we will see consumer health taking over. We will see food companies adapting to health products faster than healthcare companies incorporating nutrition. And that's what we've seen so far. Even crazy companies that you would think that are the devil themselves are working toward being healthier. And because it's a market trend, people are consuming that, they're changing their habits, and these companies that used to sell sugar for a profit or carbs now are moving to, let's find healthy alternatives, because the consumer is driving the choices as opposed to government top-down type of policies.
So I want to close with, I guess, a two-part question. Number one, how can people follow the work of Suggestic? and the things that you guys are doing. And two, imagine a year from now, you and I were chit-chatting and we're looking back. What needs to happen in order for you to feel satisfied and admiring the work of Suggestic?
So the interesting thing, so for the first question, Suggestic, how do you follow Suggestic? I don't think there's a great way to follow Suggestic. Our aim as Suggestic is not to be the most famous company in the world. It's to be empowering the most revolutionary nutrition and wellness companies out there. So you will see more of an Intel Inside kind of Suggestic. So you can, and I don't think we do a good job of promoting every one of our customers. But I think that that's what you should see. You should see more solutions out there. And even if they're not done with Suggestic, they will be inspired by our customers and the things they are doing. I think that is, we will be successful if we can help change the market toward more and more scientific wellness and more preventative and health optimization solutions out there. Now, in terms of what do I see Suggestic successful a year from now? I think that we are doing a great job right now of empowering a lot of companies. This whole financial crisis is really making more companies want faster ways to get to market and improve and increase their sales, their lifetime value, their outcomes. And we are helping them not only do that in a shorter time, but also do that at a fraction of the cost that it would cost them to do it if they were to build everything on their own. So what I really believe is that from now to a year from now, we should see hundreds of our customers empowered by Suggestic to deliver better options. I think that's what I want out of Suggestic. That's why we started Suggestic. I think that it's less about the ego of having a company that everyone knows, and it's more about having really in the hands of everyone solutions that can actually change lives.
Victor, you've pretty much hit the nail on the head when it comes to talking about delivering access and making things reachable, affordable, speed. And that's actually how I define personal innovation, is being able to provide value for many and doing it over long stretches of time. So I just want to say that I'm appreciative that I know you, and you're someone that I admire for sure. And for those that are tuning in, that are listening, if you found the content today helpful for you, would you mind sharing it on social media? Would you mind liking it, commenting it, with your network? And it makes a difference when we can have more and more innovators, doers, people that are really trying to solve for these access issues. And look, food is something that we're not going to be able to do without. And the spin that you're taking on it is something that I think is going to be needed. And we need more innovators within the space. We need more doers in the community. So it's been great having you on, and I'm looking forward to having you on again so we can kind of take a look and see how many of these companies have you empowered, and sharing more of their stories. To me, that's the success, right? Is being able to share the stories of your customers. That ultimately is going to be the winning formula in the end. So, Victor, it's been great having you on, and looking forward to our next chat.
Thank you so much, Michael.
You bet.